Hi, my name is Dr. Tony Salamay. I'm a doctor of chiropractic, and I have an office here in Panama City, Florida, and dealing with chronic health conditions such as fibromyalgia, chronic fatigue, migraine headaches, autoimmune disorders, chronic pain, and a whole host of other chronic health problems. I also hold a master's degree in clinical nutrition, and I have several postgraduate hours in functional neurology, blood chemistry, and endocrinology. Over the years, I realized that many people like you have been greatly underserved when it comes to finding the underlying cause of your health problem. Some of you have been to 5, 10 doctors and even more, and are not getting the answers, or haven't been listened to, or haven't been thoroughly tested for. And conventional medicine, they're great when it comes to emergency care. They're very good when it comes to blunt force trauma, heart attack, stroke. But when it comes to chronic care, they're just lost in a lost world. They treat chronic health problems with acute care, and it just doesn't work. Well, I'm here to tell you that there is an answer to your health problem. And the only answer comes when you find out what's actually causing it. I'm sure you've heard the saying, nothing ever really goes away until you find out what's causing it. Until you remove the cause, it always comes back. And our focus here at our clinic is to figure out what's causing your health problem. And the way we do this is we use cutting-edge methodology and scientific protocols in order to find out what's causing your problem non-invasively and with natural means. Today we're going to touch on the condition called fibromyalgia. Now, if you have fibromyalgia, you know what that means, which is pain, diffused pain all around the body, in the joints, in your muscles, and in your tissues. And with fibromyalgia, many patients that we see that have fibromyalgia are under pain medications. Some of them are very dangerous, like narcotic pain medications like tramadol, that are addictive. Some fibromyalgia patients are on Lyrica, which is actually an anti-seizure medication that really doesn't do anything to actually treat the actual problem. Others also, you might be put on Prozac or Zoloft or Cymbalta, which have serious side effects with the antidepressants and anti-anxiety medications. And a lot of people with fibromyalgia have problems with fatigue. In addition to the pain that they have, they're constantly fatigued. It's hard for them to get out of bed. They wake up in the morning. They're slow starters. In the midday, they may have a midday crash. A lot of them have immune problems as well as hormonal problems, and are problems with staying asleep as well. They can't get to sleep, and some of them have problems staying asleep. And with fibromyalgia, others have also may experience weight problems, may experience also blood sugar problems as well. I want you to know that we understand that fibromyalgia is real. Today I'm going to talk to you about the causes of fibromyalgia and the treatment methods that we use in order to treat you with the fibromyalgia. Now, you see, to take care of fibromyalgia, it doesn't come in one particular form. It doesn't come in nutrition. It doesn't come in a pill. The whole system needs to be looked at first. Once you find out the cause, then you can find an action plan put in place in order to take care of that and remove the cause of these problems and actually restore the function to greater health. So when we look at metabolics, how do we actually target it? So we found the problem. We found all these different factors, these triggers that are causing problems in the biochemistry of the body, causing problems in the hormones of the body. We assessed for your toxicity levels. We assessed different triggers. How are we going to address this? Well, once we find out what's going on with you individually, what's going on with your particular problem, your biochemistry, once we do that, then we'll be able to treat these problems through proper nutrition. And that's nutrition that's tested for, that's premium grade nutrition. And we'll use a lot of it, we'll use as whole food nutrition, organic foods that really rebuild and restore the normal biochemistry of the body. Also, we'll take a look at different herbs that help with fibromyalgia to be able to start restoring the function of the body. And we'll look at nutraceuticals. These are natural extracts from different vitamins and amino acids that help speed up the healing process and get you on your path to health. So then we have what we call neurological treatment. What do we mean by neurological treatment? Neurological treatment, we're talking about your body's nervous system. Remember how we talked about how the lower part of the brainstem is supposed to slow down the upper part of the brainstem? Well, there are other things that are going on in the brain, and we need to assess where these problems are coming from. Are they coming at what centers of the brain that are not firing properly? In addition, we need to look at all these different systems in the brain, down towards the spinal cord, down towards the nerves where they exit to. So we need to find out the level of the lesion or level of the problem and start treating these areas. And how do we treat them? Is by restoring normal communication, from the brain down through the spinal cord out to the organ. So the way we do this is through chiropractic neurological adjustments. These are specific adjustments that will normalize the communication network between your brain, spinal cord, and to your organs, and vice versa between your organs, spinal cord, up to your brain. Both are very, very important in order to get that communication system working better. So once we get that communication system working better, your organs, everything's going to function better. Your heart, your liver, your spleen, your intestines, your thyroid, everything's going to start working better. So we will look at you neurologically. We'll be doing neurological tests to assess where these problems are at and how they need to be treated. And the way we do that is through specific chiropractic adjustments. These could be done through the hand. They can be done through instrumentation. They can be done through visual stimulation. We can use glasses, hemifield glasses, that will stimulate different areas of the brain. We use auditory stim. We can use various different neurological treatments to normalize brain function and allow the body to start to heal at a core level. Also, we also use craniopathy. Craniopathy is a form of actually treating the cranial bones, making sure that the cranial bones are moving properly in proper motion, so that the cerebrospinal fluid that nourishes the nerves is actually flowing properly. We also look at your reflexes. So a lot of times people with fibromyalgia have reflexes that are coming from different organs. For instance, the intestines, for instance, will reflex into the lower back area, and they chronically cause lower back problems, lower back pain. So what we have a technique that we use that normalizes the relationship between the organs and the brain, and back forth between the brain and to the organs. So between applying various different methods, vibration therapy, different things, it's going to help reestablish and rehabilitate that nervous system so that the nervous system can start to heal. And as you start getting that control system working for you, the biochemistry starts to change, everything starts to working better. So the way we really look at you is we look at you neurologically and metabolically. Neurologically, we have patients that come anywhere from once a week, 2 times a week, some of them 3 times a week in the beginning. And they get these therapies so that their body can start to restore the function. Another thing is, as far as metabolics, we do all the testing. We use different private labs that we use to specialized private labs that will do this type of advanced testing. We'll get those testing, get the results. We'll start treating you nutritionally, finding out what are the problems first, and what nutrients are going to be tested and proven to actually get you back to health and get rid of those triggers and causes. Now, most of our patients that come with chronic health conditions, we have them, they either commute from 2 to 3 hours to come and see us. We treat them neurologically, we treat them metabolically. Now, if you're in an area where you can't fly in and get tested, we do have local labs. We have specialized labs that you can get anywhere you live in the country. We can take a look at you metabolically, look at your triggers, look at what's going on there and your biochemistry. And we can consult with you through either phone consultation or Skype through video, and we can find out what's going on there. I'm going to ask you the following 4 questions. Question number 1, how has your chronic health condition affected your job, your finances, your relationships, or any other activities? Number 2, what has this costed you in time, money, and sleep? Number 3, where do you picture yourself in 1 to 3 years if this problem is not taken care of? And number 4, what is it worth to you if we could improve your condition?